Cardiac enzymes are very important to order in the ED, especially in patients who are complaining of chest pain or patients who are at high risk of cardiac issues, like for example patients with a history of atherosclerosis or history of lipidemia or whatever. The cardiac enzymes are very important because they're highly sensitive. Troponine, for example, should be as low as 0.04 nanograms per milliliter. So we almost have no troponine in our blood. So if it rises above this level, it likely indicates cardiac issues. Troponine rises as early as 3 hours of cardiac injury, and it peaks in around 12 to 24 hours, and it remains elevated for about a week or two. ckmb is also important because its level is very low, just like troponine, and it can increase in cases of cardiac issues. It should be less than 0.3 nanograms per milliliter. And just like troponine, it rises very quickly, although it rises a little later than troponine. So within 4 to 6 hours, it begins to rise, and it peaks just like troponine in 12 to 24 hours, and it stays high for about 2 to 3 days. Myoglobin can be elevated in cases of cardiac issues, but it's not specific to the heart. It can also be increased in cases of muscular injuries or muscle fatigue. If it rises above 85 nanograms per milliliter, it can indicate cardiac or other muscular injuries. But it has the advantage that it rises very quickly within 2 to 3 hours. It peaks in around 6 to 9 hours and it stays high for about 24 hours. The kidneys are very good in excreting myoglobin. So when it rises, the kidneys quickly excrete them, and they appear reddish in urine. So the patient will complain of symptoms like hematuria. Although it wouldn't be blood, it will be myoglobin, which is actually red just like blood. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.